Thank you for everyone for joining us today. I'm Liuba Grechen Shirley. I'm the founder and CEO of Vote Mama, and we are so excited to partner with both Rachel and Peter on this incredible healthcare month that you guys are working on, because these are all important issues, and this is Healthcare Awareness Month. And I'm going to pass it to Rachel in a little bit to tell us a little bit about what they're doing with Healthcare Awareness Month. But I'll start with just a quick overview of Vote Mama. I am so happy to be here with some of our amazing candidates. Maternal health is the topic of today's conversation. The reason that we need more moms in office in general is because these are the issues that do not get talked about enough. When I ran for office, I ran for Congress in 2018, and anytime I would talk about things like paid leave or childcare, someone would say, ignore the women's issues and stick to the bread and butter issues. But these are the bread and butter issues. And maternal health, we have the worst maternal health rate, maternal mortality rate in the entire industrialized world. And the reason for this is that we don't have more moms in office because legislators legislate based on our lived experience. If you have people who understand what it's like to go through pregnancy and childbirth in a country where we have the worst maternal mortality rate in the industrialized world, we would have different policies. And we don't have that right now. If you look at our Congress members, only 7% of our current Congress members are mothers with children 18 or younger. That needs to change. We are 27th globally in healthcare. We are 27th in education. We have the worst maternal mortality rate. It is more expensive to send your infants to childcare than it is to send your teenager to college. And this all comes down to who represents us, to who has a seat at the table and what their lived experience looks like. I launched Vote Mama, our PAC side first, to support Democratic moms running from school board to Senate, moms who will go out there and fight for the issues that matter most to working families. Our policies have failed women and children for generations, and it's simply because we don't have enough of them at the table. I launched our foundation side, Vote Mama Foundation, to continue to break down the cultural and structural barriers that moms face, both when they run and when they serve. I was just speaking right before this call with a candidate who is a mayor and was running for a state seat, and she left the race because of the abuse that she was getting with her children, for running with her children, and she didn't feel that it was safe, and she actually left the race. And she was telling me about her experience, and I told her, these are stories that I've heard from women running across the country. The Old Boys Network is alive and well. We need to build the Mamas Network. We need to have mamas running across the country, talking to each other, sharing their experiences, normalizing what it looks like, and knowing they're not alone. Because that mom who just went through that felt lonely. And every other mom who's running across this country at some point has felt lonely because they are going up against the political agenda of so many people who've been here and been in power for so much longer, and it needs to change. And that's what we do here at Vote Mama. We are working to break down the structural barriers. We're working to pass campaign funds for childcare across the country, to break down a financial structural barrier to make it easier for moms to run. And we're working to normalize what it looks like to be a mom in office, to talk about breastfeeding, to talk about pumping, to talk about needing to take back paid family leave, to talk about what it's like to give birth. And that's what we're going to talk about today, maternal health in this country. So before we jump into our candidates, I want to pass it over to Rachel. Can you please tell us a little bit about what you guys are doing with Healthcare Awareness Month? And we're so proud to partner with you.
Thank you, Liuba. We're so honored and proud to be partnering with Vote Mama and with your team on this and on other panels that we've done during Healthcare Awareness Month. Healthcare Awareness Month really grew out of advocacy and activism done by Peter Morley, who you can find on Twitter more than my SLE, and I'll put his name in the chat. And Peter took stories from different members of the public to their representatives in Congress. And through doing that, was able to share those stories and advocate and find ways of getting through to members of Congress and legislators. What happened after COVID was that between COVID and the January 6th insurrection, it got much harder to go down to DC, which Peter would do to bring these stories down. And so he and I were sitting in his apartment one day, and he had the idea to go to some legislators in the Hudson Valley, and he was going to take Amtrak. And I said, oh, I'll drive you. And that was kind of the beginning of Healthcare Awareness Month. And what we want to do is take the opportunity to really lift up the work that's being done on healthcare. So whether that's Vote Mama and the work that these guys are doing, or these ladies are doing, to make sure that we have more representation from moms in office, whether that's, a gun violence panel that we also helped co-produce with Vote Mama earlier this year. We have Twitter spaces on patient advocacy every Friday at noon. And we release digital content that we've made with members of Congress lifting up the healthcare work that they're doing. So all of that and working with our partner organizations to lift up these voices is really what Healthcare Awareness Month is all about.
Thank you. Thank you very much. I still remember the first time I met Peter. He has been such an incredible advocate, and I'm just so honored to partner with you. So I would like to take this opportunity to introduce our incredible candidates. We have Dr. Annie Andrews, who's running for Congress in South Carolina's 1st District with us. We have Rep Athena Salman from Arizona with us, and we have Kaegan Mays-Williams, who is running for State Senate in New York, very close to my house. I am going to ask each of you to take a few minutes and just introduce yourselves and tell us a little bit about your campaign before we jump into questions. Annie, do you want to start?
Yeah, I'd be happy to. Thank you so much for having me. I'm Dr. Annie Andrews. I'm the Democratic nominee for Congress in South Carolina's 1st District, and I'm a pediatrician. I've worked at the Children's Hospital here in Charleston, South Carolina since 2009. I am also a mom to 3 incredible kids. My kids are 10, 7, and 5. And I'm a Moms Demand Action volunteer and a gun violence prevention researcher. So it really is my roles as a mom and a pediatrician that made me decide to run for Congress, which is something I never in a million years thought I would do. But when I jumped into this race, I was just so happy to have the backing of Vote Mama. They have been incredibly supportive, and everything Liuba said at the beginning are so many of the reasons I'm running, and I'll get into this later, but we're seeing the effects of not having women in office every day. A senator from my state, Senator Tim Scott, sent out a fundraising email talking about the 52 weeks of pregnancy just last week. So these men who are making these laws don't know what they're talking about, and it's time for more women. It's time for more doctors, more scientists to be at the table. So I'm really happy to be here.
52 weeks pregnancy.
Mm-hmm.
Can you send me that email?
Yes.
Jesus. All right. Kaegan, can you introduce yourself, please?
Yes, thank you, Liuba. I mean, that would be one big baby and there'd be no more amniotic fluid. But I digress. Hi, my name is Kaegan Mays-Williams. I'm running for State Senate in New York Senate District 21, which is both central and southern Brooklyn. I'm so grateful to be here. I'm here as a candidate, but I also come to this space from a very personal place. As in 2017, 5 years ago, I almost lost my life when I had a fibroid removed during my C-section. I remember it very clearly, getting an opportunity to have my child's very warm cheek on my face, and then the next moment I was catatonic and vomiting, and there was blood everywhere. It took about 3 or 4 blood transfusions to make sure that I was here today. And one of the many reasons that I'm running is because there are a lot of women, particularly in Brooklyn in 2017, that didn't make it out of the hospital alive. And it's in part because there's very little advocacy around women's reproductive health. And as we all know, as Liuba said, so I'm so very honored to be here today. I'm also really excited, Dr. Andrews, that you're a Moms Demand Action volunteer. I currently work at Everytown for Gun Safety, where I'm a policy and legislative policy counsel. I draft laws all over the country to reduce gun violence, and I'm so happy to have the opportunity to possibly do that work here in New York. So thank you so much.
Thank you. And Rep Salman.
Good morning, everyone. Liuba and Vote Mama, thanks for having me on the panel today with Dr. Andrews and Ms. Mays-Williams. Like, it's really an honor to share this space with everyone. My name is Athena Salman. I was first elected to the Arizona State House of Representatives in 2017. I'm running for re-election for my last term in the House. When I originally ran, I was not a mother, but this year I had the joy of welcoming my first child the first week that session started in the midst of a COVID-19 surge. And it's a joy. I was running a little behind because I was putting my baby to sleep right before this panel. And, you know, I'm personally during the interim juggling the childcare responsibilities. And, you know, it really is a struggle and now experiencing it firsthand, having to figure out childcare and who can watch the baby. But then understanding and realizing at a deeper level, this is what it means when government doesn't provide that assistance. But I became connected with Vote Mama because in my chamber, the Republicans control the House, and it's all men on their leadership team. And in the midst of a COVID-19 surge, instead of making accommodations so I wouldn't contract COVID right before going into labor, they were trying to force me to come in person in an environment that doesn't require vaccinations, in an environment that doesn't require masks, in an environment where the ventilation, our buildings were built in the 1970s, the windows don't open, and several lawmakers, I refused to go, but several lawmakers that week walked away with COVID-19, and I made the best choice for my family and for my baby and for my own safe and healthy safety and recovery. And I'm just really excited that we're having this conversation today. The last thing I'll mention of a renewed reason of why I'm running for office is I've really run the lead in my caucus on reproductive health issues, including protecting abortion rights. And even in my own tenure, the amount of different ways that the Republicans have criminalized abortion care, therefore criminalizing the full spectrum of reproductive health care, whether it's potentially outlawing birth control, to the police now looking into people who have stillbirths or miscarriages, as we're seeing in that state and beyond. Arizona, unfortunately, it's one of those states where police surveillance will be turned against women seeking reproductive health care and seeking to make very personal decisions about their pregnancies with their doctors. So this is another renewed reason why we need more women in office, why we need women of child rearing age who are starting their family, growing their families, because, you know, we are on the front lines of the violence that's being perpetuated by very bad faith actors from state legislatures all the way to our Supreme Court.
Exactly. I'm just honestly listening to the three of you. This is why I do what I do and why we need more moms in office. And Kaegan, you reminded me, I spoke on a panel with another one of our state Senate candidates and an actress, and the three of us were sharing our birth experiences. And none of us walked into that room thinking that we were going to walk out that emotional, but we each ended up sharing our birth experiences, and we each had traumatic birth experiences, and we each had people who didn't understand them and didn't understand what it would take to recover from them. And you just reminded me that the one thing I remember so much from my childbirth, my first childbirth, was I ended up having an emergency C-section after 23 hours of unmedicated labor. And I still remember the anesthesiologist telling me to use my words because I was crying and couldn't speak. And they just kept repeating, use your words, use your words. And having people who don't understand what it's like to actually go through that, and the misogyny that is involved in childbirth in particular, and then what it's like to recover from that without paid family leave, and then to be forced to go back to work while you're bleeding and still recovering. These panels and the panel that we had, not too long ago this summer, listening to these stories of all of these people who will hopefully be in office and will become legislators, those are the stories that we need out there, and those are the people we need making decisions on how these policies affect us. So thank you for the three of you for being here. And I think we have a recorded call from our good friend, Lauren Underwood. I think Rachel is going to share that. Yep.
Hi, everybody. I'm Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. I would like to thank you for the invitation to join you today, and I'd also like to thank you for your work to elevate our nation's maternal health crisis and highlight the need for evidence-based policy solutions to save lives and end disparities. As a co-founder and co-chair of the Black Maternal Health Caucus, alongside Congresswoman Alma Adams, I join you in the mission to eliminate preventable maternal mortality and advance birth equity for families across the United States. The shameful data that have become very familiar to many of us. Our nation has the highest maternal mortality rate of any high-income country, and the majority of these deaths are preventable. The pregnancy-related mortality rate for Black and Native Americans is 2 to 4 times higher than the rate for white Americans. And Hispanic and AAPI people also experience elevated rates of maternal mortality and morbidity. These statistics are tragic, they're unacceptable, and they're a call to action that each of us has a responsibility to answer. That's why last year, I introduced a sweeping package of 12 bills to address our nation's maternal mortality crisis, the Black Maternal Health Mommybus Act, which builds on existing legislation to comprehensively address every driver of maternal mortality, morbidities, and disparities in America. The legislation includes investments to grow and diversify the perinatal workforce, improve data collection, fund community-based organizations, expand access to housing, nutrition, and healthy environments during and after pregnancy, and support moms with mental health conditions and substance use disorders. I was proud to introduce the Mommy Bus with then Senator, now Vice President Kamala Harris in 2020, and I am thrilled to be partnering with her now to move these priorities forward. And over the past year, we've seen historic progress, with the first Mommy Bus bill signed into law and another passing the House with unanimous bipartisan support. In March of 2022, Congress passed government funding legislation with nearly $1 billion in investments for evidence-based maternal health programs at the national, state, and local levels. And the president's budget request for the next fiscal year includes historic funding for programs directly from the Mommy Bus, like investments to address social determinants of health and to grow our doula and midwifery workforces. And on top of these achievements, the Build Back Better Act passed the House with every eligible Mommy Bus provision included, as well as year-long expansion of postpartum Medicaid coverage in every state, the largest maternal health equity investment in United States history. It is essential that the Senate takes action to advance these maternal health investments that families are counting on. There's no time to waste. Thank you for everything you are doing to elevate this important issue. I look forward to the day I can be with you in person, but until then, take good care of yourselves.
Lauren is doing amazing work. I remember the first time I met Lauren, we were both had just launched our campaigns and she was still working as a nurse full time while trying to campaign and juggling it all. And it was incredible to watch. And Annie, you did the same thing. You're now not working still in the hospital, right?
Yeah, I'm working a couple shifts a month at the Children's Hospital just to give me the opportunity to come face to face with the people I'm trying to represent.
It's incredible. It's incredible that you're able to do that. All right, I want to start with questions. We're talking about maternal health and we just lost the right to row. And I want to take a moment to ask really how that affected you as a mom. We all knew it was coming. We weren't surprised. I was in Disneyland with my 3 kids when it happened and I started to cry in Disney. And you're supposed to be happy in Disney. And I was crying because it wasn't a surprise, but it was devastating to realize that my 8-year-old daughter will have fewer rights than my mother has had for the majority of her life. So tell me how it has impacted you as a mom and how has it changed your campaign strategy? And Athena, do you wanna start?
Yeah, I really appreciate this question. I've been talking about the end of Roe for some time because Arizona has antiquated laws on the books from before we were even a state that was criminalizing both abortion and birth control. I don't think people realize in a post-Roe society, an overzealous prosecutor can start going after people for advertising birth control. So, but it's just, I mean, it's this weird feeling to be in the position where you're having conversation for years with journalists, trying to get them to understand this is a serious threat. Meanwhile, people being patronizing of, oh, the Supreme Court will never do that. Oh, the Supreme Court, they care about their legitimacy. And then when it actually happened, at first I felt kind of numb and lethargic. Like it was just like, oh, okay, well, it happened. Like I wasn't surprised. But then because my state is, we're very purple. People know our 2 United States senators are technically Democrats. One acts like a Republican, but they're technically Democrats. Our legislature is almost at 50% Democrat. So we're a purple state, but the Republicans that are in charge, I mean, these are election deniers, the people that just won the primaries, governor, attorney general, superintendent, public instructor, these people that are going, secretary of state, who's in charge of our elections, they are election deniers. They are people who advance policies that are hostile to women. And so I just kept thinking about, I had my first child. I would like to grow my family. And beyond that, like, am I going to be able to utilize all the birth control options that I want to when I'm done growing my family? Or is the legislature going to claim that some of that's illegal now? If I undergo this next pregnancy and there's complications and the pregnancy doesn't end in a live birth, am I going to then have a law enforcement officers showing up or issuing warrants or really getting invasive into something that, you know, this first pregnancy just wasn't an issue because the law protected me against a overzealous police state. So it's very disturbing. And now to see what happened to the teenager and her mom, I mean, it's also, I think the last reaction among many just different ways that I processed this is I want people to understand the Republicans that I work with are so extreme. Like, some of them would happily eliminate the 19th Amendment, and absent of rewriting the Constitution, which there is a movement, it's called the Convention of States, that are passing through state legislatures to completely rewrite our Constitution and eliminate the very few equal protections that we have in the Constitution. You know, the project to ban abortion, the project to criminalize reproductive health care is a project to strip women of their right to vote. We already do it to people of color in massive amount of scales, where we charge people with felonies and they no longer can cast their right to vote. And I think what we're seeing the beginnings of is women and you know, teenagers who are about to become adults at a massive scale, who are not going to be able to participate in our democracy because of these new laws that are going to be weaponized. And we already seen it. Women are the fastest growing prison demographic in the country. They do not commit violent crimes. These are drug addictions. You know, we're talking about maternal health. These are drug addictions. We criminalize women for issues of poverty, for child neglect because they can't afford childcare. And instead of investing like in the Build Back Better bill that unfortunately one of my senators refused to pass because she wanted to side with Mitch McConnell, we then result to the criminal code, and that's the pipeline that I see in my state for women, and I think that we see throughout the country. So it's, you know, it's a lot weighing on me. It is very tumultuous time to want to be growing your family and to live in a state where abortion is not only illegal, it is criminalized, and starting to organize and think about what are those defense systems we have. So as women who largely will come from communities of color are caught up in this very violent pipeline, how we can defend and stand up for them and make sure that we are unapologetically advocating for their rights.
Everything that you just said is so true and so depressing and so overwhelming. And I mean, I don't even have a response to it because that is sadly what our country is right now. And I'm grateful that you guys are doing what you're doing to try to fight this. Kaegan and Annie, do you want to, Kaegan, I said Kaegan. Kaegan and Annie, do you guys want to jump in? I'd love to hear your thoughts on how this has affected you as an individual and how it's affected your campaign strategy and what you're talking about with voters. How are you talking about this with voters?
Well, I'm happy to speak for a moment. Two main thoughts come to mind, you know, particularly as a queer woman, you know, where IVF is a primary way that many women who are queer or birthing people need to grow their families. And this idea that you may be penalized for one, creating an embryo out of it, there becomes a question of when life begins, right? And whether it will be criminalized. Can you freeze embryos for another time? Will that be considered criminal? Are you allowed to test embryos? Many women go through genetic testing because if you don't and you have an embryo that might not otherwise survive, women are essentially being forced to have miscarriage after miscarriage, which many women are forced to do anyway because testing is not covered by most insurance policies. You have to pay out of pocket and it is very expensive. And so many women already have to undergo kind of the barbaric nature of hoping that the embryo will take. Otherwise, they suffer a lot of different miscarriages. So there are a lot of issues with regard to IVF for not only queer women, but of course I come to that space thinking about my own family, but a lot of women that I know who have needed assistance reproducing and growing their families in non-traditional ways. That sounds very antiquated way to say that, but so that was one major thought that came to mind. And it also kind of harkened me back to when I started to try to become a mother in 2015. And I was very excited at my 7-week appointment to find out that actually, even though I had all of the symptoms, that the fetus had stopped growing. And maybe it's not considered a fetus that early, but I felt very connected to it. And I had to make a very difficult decision of whether or not I should have a DNC, given that I still had all of the symptoms. And psychologically, I was going through a very difficult time, and we don't also provide healthcare to help a lot of birthing people with the mental effects of becoming parents, or of putting your body through the work of becoming a parent. And so that was a difficult decision to make, but I needed to make it for my own wellness. And those are two things that came to mind. How has it affected my campaign? Not at all, because I've always been thinking about issues of women's reproductive health. The 66% of the electorate in Brooklyn are women, and we haven't had a woman represent us in over a generation, bless you. And so it's really important that when you come to the table with all of your professional and lived experiences, as Liuba said. And so fortunately or unfortunately, hasn't changed anything, because I always wanted to talk about issues impacting women's health.
Sharing that. Thank you. Annie, would you like to add a few?
Sure. Yeah, I'm thinking back to how I felt that day. I mean, I think I responded to it as a mom first, just worried about my own daughters. As a pediatrician and seeing, the effects of teenage pregnancy and everything, I've always planned to encourage my daughters to get IUDs when I felt like they were at the right age for that. And because I think that that is the, most scientifically appropriate way to keep them safe in those years. And to think that that might not be an option was like sort of the most practical, immediate, terrifying piece of this. And then I also responded to it, of course, as a physician. And there's just been a series of things that state legislatures across this country are doing that are anti-science. And in particular, this one is forcing OBGYNs and neonatologists and family medicine doctors to decide if they want to provide evidence-based care or decide if they want to follow the law. And in my, near 15 years of practicing medicine, that's never been the case. The law and evidence-based medicine have never been at odds, and they are now. And people say, oh, well, we'll have exceptions, but it's not as clear as that. I have talked to so many doctors in my community, whether they're OBs, emergency medicine doctors, even radiologists who are reading these ultrasounds, who say that, they know what the science tells them they need to do in a given medical situation, but now they're forced to walk out of the exam room and call the lawyers. And then that is never something that we have done as doctors, but it is happening in my community, in every community. And so the devastating immediate effects of Roe falling. And then, lastly, I'll say I am in this unique position of running against an anti-choice woman who has a horrific record on this issue and many other issues. She helped co-author South Carolina's current 6-week abortion ban. And she's trying to spin it to say that she's the moderate because she supports exceptions. And so I feel like I'm in this, upside down world where, what's right isn't what's right anymore. And it's really hard as a scientist who comes from a profession where everything is based on data and truth. You can't be a doctor and lie every day. And now I'm operating in this world where the truth doesn't seem to matter as much. And it's hard for me as a scientist to be running. But, the heartwarming part is as soon as Roe fell at my campaign events, the median age of attendee went plummeted. All these 20-something, young 30-something women started showing up at my events. They'd walk up to me and they'd say, I've never come to a political event before, but I'm here and I brought a friend and we want to figure out what we can do to make this right. So that side of it, being on the campaign trail during this crazy moment in our nation's history, does give me a lot of hope for the future.
All right, thank you. Without federal policy, can you guys talk about some of the key policy solutions that we can do at the state and local level? Kaegan, you're running for state senate in New York, which is a sanctuary state. What can other states do to do what New York does? And can you talk us through a little bit about some of New York's policy solutions?
Yes, absolutely. And I was going to say, I was first researching what New York had left to do. And of course, we still need to codify abortion rights in our Constitution, but New York has done quite a lot already. So I'm hoping that the constitutional amendment will be the thing that I work on in January. But until then, New York has recently passed some legislation which expands which medical professionals can provide abortions, including nurse practitioners, to make sure that there are as many professionals as possible, including doctors, because to be honest, we are about to deal with a lot of women coming from other states that are coming in that are going to need services. So we needed to expand the amount of people that could provide those services. We are protecting abortion providers from getting sued by other states. Doctors who are or providers who are providing abortions, we don't want them to be sued by states where abortions are illegal. So New York has passed legislation to protect them as well. New York State's also set aside $35 million to support people from those more restrictive states in order to get them what they need. Abortion providers have also been given $25 million to expand their own infrastructures and capacity with the amount of people that we expect to get. An additional $10 million is going to be used to boost security of facilities providing care. And more than that, New York City is also allocating municipal funds specifically for abortions, and the city's budget is going to fund $250,000 in the fund that was set up in 2019. And so I'm very much hoping that other states and local municipalities can replicate some of the work that New York has already done.
All right, thank you. Athena, tell us a little bit about what's going on in Arizona, what you can do, what is possible, and what do you see kind of in the next leg cycle? What do you think will be happening?
First of all, I'm really excited about the work that's happening in New York and other safe haven states. I think that this is something that is going to be huge for pregnant people who come from states like mine, where I think the legislature, I think we can maybe split a chamber or two if we do have a good year in this midterm elections, but for our legislature to be a Democratic majority, I'm not optimistic this cycle. And so to repeal and to undo the damage that's already on the books, that's a long-term project, but I don't think that's realistic. I think one thing that's going to be a big question mark, regardless of who's in power in the legislature, is who's going to end up being our governor if we get a Democratic governor. And we have Katie Hobbs, who's also a mother who's running for governor. When she was in the legislature, she was the center counterpart. I was the House counterpart who was doing a lot of legislation on reproductive health care and repealing the attacks on abortion. So if she's the governor, we can at least hold the line on how the anti-abortion movement is going to start morphing. If we get the attorney general and we have a couple county prosecutors that are up this cycle, and if Democrats are able to get it, and they've vowed not to prosecute for reproductive health care, but in a Republican trifecta scenario, then they're going to shift from criminal elements, and they're going to start doing more vigilantism like they do in Texas, and start doing civil penalties of the individual, of the provider, and we're going to see an expansion of that. So I think in Arizona, it's really holding the line and stopping more damage from happening while still advocating for the social solutions that maybe 10, 20 years ago, this was something that we could agree upon with the other party. But today, I mean, just there's 30,000 children who are uninsured, who are low income children in Arizona. It would only cost the state like $12 million to expand Medicaid access, to expand our CHIP program. We would draw down millions upon millions of federal funding to match that. And they can't be bothered to do it. This is every single year I've been in the legislature, we've been advocating for dental coverage for pregnant women, especially since there's a strong link between oral health care and the rate of miscarriages or preterm labor. These people that say that they're pro-life, we can't get them to do it. We're going to keep advocating for these healthcare solutions. We're going to keep advocating for expanded access to childcare. But it really, I mean, if we have the governor, then we are really in the ballpark where we can get some of these priorities through in the budget, and we could stop these attacks. But if we are living in the unfortunate reality where Republicans maintain their trifecta, it's just going to be a heavy defense type of ordeal, for lack of a better word, these next upcoming 2 years. So that's what we're looking at. And we'll continue to work and push our congressional delegation to step up and do more, so that at least we can get some federal investment from the top down into the state.
We're supporting Chris Mays. She's one of our candidates. We need to make Attorney General.
She's amazing. Yeah.
They're not pro-life. That's the thing. They're pro-controlling women, and we all know that. And if they were pro-life, we'd be passing things like paid family leave, actual paid family leave, and healthcare. We're the only industrialized nation also without universal healthcare in this country. And you give birth and you walk out with tens of thousands of dollars worth of debt. And even if you have insurance, it still costs you many, many thousands of dollars. So there is no pro-life on that side. But I will not go into that right now. Annie, do you want to add anything to this question?
I'll just quickly say we're in a very similar situation in South Carolina where, we're in a very desperate situation, and sort of our one hope at the state level is to secure the governor's seat. And so one of the things I'm working on is channeling all this activation I'm seeing at my campaign events and using my social media platforms to get people to understand that we are so close to an election and this might be our last chance. And then the other thing we're trying to do is just work with all of the organizations that are raising money to help South Carolinian women go out of state for abortion, because it is a very desperate situation down here.
All right. I'm curious, as moms running for office, what are some of the other policy ideas? What are some of the other proposals that you have specifically around maternal health, but also just in your experience running for office, what are the major things that you want to focus on that you've thought of because you're a mom that somebody else might not have thought of because they haven't had that lived experience? And anybody, please.
I can jump in and probably not surprisingly talk a little bit about gun violence. The leading cause of death for pregnant people in this country is homicide. We are living in a gun violence public health crisis. And, I don't think it takes being a mother to care about gun violence, but I do think that being a mother makes me care about sort of in a more unique way. I said at an event the other night that this year my kids will be in the same school building for 1 year. They're going to be in 5th grade, 2nd grade, and kindergarten. So 1 year, I'm going to drop them all off at the same building. And that's so cool and exciting. But also, I can't help but think, if there's a shooter in that building, all 3 of my babies are in that building. And I think that as mothers, we see the urgency and we see the injustice of our children having to walk into a school building where they might not be safe, and our elected officials not caring enough about that to pass common sense laws. On top of that, so many children in this country that grow up in unsafe neighborhoods who are, just afflicted by daily gun violence, and our leaders just are not doing enough. I've worked a lot in the gun violence prevention arena, and one of the things that we can do to help protect children is a federal secure storage law. There are laws that are moving at the federal level to make that happen, but states like South Carolina don't have a state secure storage law, but that could really help reduce the incidence of youth suicide, unintentional shootings in young children, and it can help protect women who are in these domestic violence situations as well. So that is something that I hope to be able to focus on.
The fact that you have the thought in your head that all 3 of your babies are going to be in the same school, And when I dropped my children off right after the last shooting, the shooting in Uvalde, not the last one, but when I dropped my kids off, I literally thought my daughter's second grade classroom is far away from the front door, but my son's kindergarten classroom is right near the front door. And that was the thought that I had. And then you have this thought about all three of your kids will be in one school, and all of us have these seriously unhealthy but realistic thoughts in this country. And what are we doing to the mental health? If we as mothers, as grown adults are having these thoughts, what are we doing to an entire generation of children? Because they're all thinking the same things, and we are not investing in that. So this Republicans' refusal to actually pass any sort of common sense gun regulation or reform is also affecting the mental health of so many people in this country. The mental trauma alone is just, it's too much, and it really will have serious impacts. I graduated high school in 1998, the year before Columbine happened. I never experienced any of this as a child, and it scares the hell out of me every day as an adult. So I can't imagine. Kaegan, would you like to answer?
Yeah, absolutely. So many thoughts. Dr. Andrews, thank you for bringing that up. I think about actually my child had an active shooting drill. And, based on my work at Everytown, I understand what the mental health effects can be. And my child was 4. And I was like, I want to know exactly what the procedures are. I sent them research briefings, and I was very much concerned that this be conducted in a way that my child knew it was a drill, and that her classmates wouldn't be traumatized, because they were also around when there was that terrible shooting in Sunset Park, and the kids had no understanding of why they couldn't go outside. So of course I'm constantly thinking about gun violence prevention measures. So I'm so glad that you brought that up, Dr. Andrews. But something else that I think about often is a lot of the volunteers on this particular campaign are our neighbors and our friends. And one thing that we have in common is that we all have children under the age pretty much of 7. Most of us are the mothers of very young children. And in order for them to help support the campaign, they've essentially had to create a co-op of watching each other's children so that we can get representation that's constantly thinking about the way that we live. We have so many people being pushed back into the office when they can do their work pretty much from anywhere, and thinking about the balance of working and being able to care for your children and being able to make everything happen. And it's also, it's just such an ableist policy that has impacted a lot of moms living with disabilities who are also trying to do all of the things that we're trying to do. So I think as a person running for office and as a mother of a young child, I'm thinking about all the hats that moms wear that are very different sometimes from the hats that dads wear. I'm running against 2 men. I'm the only woman in the race, and I think their children are almost as young as mine. But nobody's asking. People ask me all the time. They're like, "Are you sure you want to be in Albany? You're going to be really far away from your child." I'm like, let me ask you, have you asked the other 2 candidates that question? Like, do I want to be away from my child? Absolutely not. But there are, my child will not always be a child, and I'm fighting for her future and the future of her neighbors and everybody in our district. And it's just interesting because I don't think that the men get this question. So, I'm thinking about a lot of things as a parent. But that is particularly one of them. And one other, just if we're speaking just about maternal health, particularly in Brooklyn, there was a New York City report that highlighted a 2016 study that Brooklyn has the highest maternal mortality in the city. So making sure that we have health insurance plans that provide for coverage of midwifery and doula services is really, really important. And making sure that doulas are being paid a living wage is really critical to making sure that a lot of the people in my district are able to live.
Yes to so many of those things. The day that my daughter started kindergarten, I was at an event with Shannon Watts. Actually, she came to Long Island to speak for one of our candidates, and I was telling her that I was terrified to send my kid to school, and I didn't want her to go through lockdown drills. And she actually shared the research that Everytown had put out that showed how detrimental it is and the mental health effect on children, and that it doesn't actually prepare them or make them safer. It just is causing serious mental harm. And my kids are in private school. I was able to have that conversation with the principal, and I asked, tell me every time there's a lockdown drill, I'm taking them out of school for that day. And with something we've actually talked with some of our school board candidates about, because if you're in a public school, you don't have that option. They don't tell you beforehand. And I think it's something that all parents should have the option to opt out and to not have their children in those lockdown drills. You cannot explain to a 4-year-old what an active shooter drill is in any sort of way that doesn't terrify them and make it more dangerous. Every mom I have ever spoken to who's ever run for office has gotten that same question. Who will watch your kids while you campaign? How will you possibly do this? Men are never asked that question, I can tell you that. And if they have kids and they're running, they are automatically looked at as a responsible adult who understands what their community members need and the support that they need. So we're actually making little hats that say, but who will watch us, for the kids of all of our candidates, because everyone has had that question and it's ridiculous. All right, Athena, do you want to add anything, please?
No, I just really appreciate what Kaegan said, what Annie said. And honestly, I would just be repeating the same things. It's hitting the nail on the head with, especially as a new mother. Even though my child's not gonna be in school for a while, I'm already like, what are my options? Which is really sad. You add on top of that, Kaegan's talking about the remote work, the pandemic, and the stressors, a pandemic on top of pandemic on top of pandemic. Like, it's just, and this complete denial by our policymakers that this is even an ongoing thing, and that there's even growing threats of different viruses out there, and the unwillingness to follow the science and actually do what's necessary to stop or just mitigate the spread of these diseases. So that's how I got connected to Vote Mama, was because of trying to fight for the right to continue the same kind of remote accommodations that we had in 2021 during 2022, and that refusal by Republicans to make that accommodation, not only for myself, but also in my advocacy, advocating for people with disabilities, advocating for senior citizens, advocating for pregnant people and people who just welcome children into their lives, young newborns who would not be safe at the Capitol environment. So the only thing, I guess, to build on what was already said is just thinking about the ways that we can still make our democracy inclusive, all the way from your right to vote, but then also once you have elected representatives at the school board, city councils, at the legislature, what are ways that we should have been doing before the pandemic, but we should absolutely be doing now, that we're in this very public health emergency status, how we can ensure that we're still hearing from all those voices. And some of my colleagues who have been in denial that there is a pandemic to begin with, who have compared COVID to the flu since day one in 2020, in March in 2020, and really have downplayed this. They also pretend like sending an email or calling your representative has the same impact and the same level of having your voice heard as showing up to a committee testimony and hearing and actually putting your thoughts out there so that the public can observe, and so that reporters have an opportunity to include that narrative or include those ideas in whatever policy that we're debating. So I think that's just the only other thing. But honestly, the two other panelists, I'm just like, yep. Like they just brought really good points that have been weighing on me as well.
I feel the same way listening to all of you. And this is why I love being able to bring together all of the moms that we support running across the country, because you're all working on the most critical aspects of what we need. I did not realize that we are almost out of time, by the way. So it was very much enjoying talking to all of you, but I think we need to open it up to questions from the people who are here. And I'm sorry I did not leave more time for that. I think Sarah is monitoring the chat. I see a bunch of comments going back and forth in the chat. So please, if you have a question, if you want to make a comment, raise your hand and Rachel will unmute you. Questions, comments? Julia, I noticed that you posted something in the chat, but did not see what it was.
Yeah, it wasn't a question. I was just mentioning how like in high school I had like an experience where we had like a lockdown drill and they told us it was drill, but then we got a news notification that there was a gun in the building and we saw like the SWAT team outside, and it was actually a day we had a substitute teacher, so she didn't get to lock the door, so we were, you know, putting the chairs on the door, and yeah, she's like, I didn't have training on this, like what do I do? And I'm like, I don't know, I'm 16. So yeah, it just mentioning that, and it seems like there's been similar experiences.
My mom was doing a lockdown drill. My mom was a teacher. She's retired now, but she was 60 something and she did a lockdown drill. She came home crying. So I can't even imagine what a 16-year-old would feel like going through that. My mom had to lock the door. She knew to lock the door, but then one of her children were in the hallway and she's like, I could see the kid, and they're literally told you have to lock the door even if somebody is in the hallway, and you can see the kid through the window in the door. And she said the kid was panicking. She was panicking. She went in to open the door and she came home and was so distraught. And this is a woman in her 60s. So I can't imagine being a 16-year-old and dealing with that. I'm sorry that you have to.
Yeah, I know Janique also had a story, but I was in elementary school in DC in 2002 during the DC sniper attacks, if you guys remember those. And oh my God, I choked up just thinking about it. They told us that there were like bees outside, but we all knew what was going on. And so we weren't allowed to go outside, and it went on for weeks, and it was really terrifying. And then a few months ago, I was at the March for Our Lives in DC, and there was an active shooter scare. And everybody was scared that I was with a group, but seeing just a mass of people all of a sudden stampeding towards you and knowing what it meant, and then turning around, running, seeing children falling, trying to help parents with their kids. And it probably only lasted like 30 seconds, honestly, but I had a panic attack for a good 4 hours after that. And I couldn't calm down. I just couldn't figure out like I knew that it was over and I knew I was okay. But I mean, I've talked about it in therapy since, honestly, and it just feels like it's this childhood trauma from like all of these active shooter scares as a kid that I couldn't shake this panic attack for hours. And yeah, it really, and you know, I was at the beginning of all of this, and I can't imagine how kids are now. So I mean,
sorry, Julia. I was just saying, like I had said in the comments, like, first off, I want to say thank you to all the candidates who are here talking about it. My mom actually, when the Sandy Hook shooting happened, I was in middle school, and I went to a school that was from pre-K to 12th grade. So we had 5-year-olds at my school, but we also had 17-year-olds on my school, and it was a campus, and it wasn't really blocked off. So like really anybody could walk on and do anything. And I remember when it happened and my mom was listening to President Obama's speech, she was like sobbing, and I'm like, Mom, like what's wrong? And she's like, I'm like scared for you to go to school. Like, I don't want you to go to school today. Like, what would you do in that situation? So I was like, oh, well, Mom, like we have drills that tell us what to do if that happens. And my mom, like, her face was in like pure shock. She was like, I never had to grow up like knowing what to do if someone came with the intention of killing me while I'm in school. And I was just saying, in high school, I was like in junior year of high school, and they had announced an active shooter drill, but they didn't say it was a drill. And usually we're like, really, when you've gone through the lockdown drills, you know what to listen for to know if like it's real or not. And they didn't say drill. And I remember me and my friend looking at each other and just starting to cry, because we were like, this literally could be like it, like this could literally be the end of it. So it's just really, it's really scary, but in a weird way, it's helpful to know that other people have went through the same thing. But I just say thanks to you all who are moms who are trying to stop that for future generations, because it definitely does have an impact on your day-to-day life when you go through that during your formidable years.
Hey, this is Tana in Lexington. I too would like to thank the panelists. And I'm just bringing from the mother side, headed to the school to get my kids, and with the gun that is in the school and how chaotic that is. And now the fact that they have to walk in and out of metal detectors every day, and the fact that the metal detectors was at the door and the gun still got in. So just standing in the line trying to get my kids out, no one giving directions, parents just crowding at the door, and then actually trying to get my kids, and I don't see my neighbors, so I'm trying to get their kids, and they're wanting you to fill out all of these forms, and there's no time to fill out forms when there's a gun in the school. And so I just wanted to bring that to the table. Thank you for all the stories. Thank you for the education that I received here in Kentucky. And this is just an awesome experience. And thank you all for sharing your experience with me.
Thank you, Tina. Tina is one of our mamas who's actually running for Lexington City Council. So thank you for being here. We need your voice. I know that we are wrapping up. Julia, I'm sorry, I'm gonna ask, what you said you had to run for your life at a festival. Can you tell us that story? Rachel, can we unmute Julia?
There we go. Okay. Yeah, no, after I didn't want to tell that to you because it's like, okay, she keeps going. But I'm so sorry. I'm so sorry.
Don't worry.
But after that happened, I went to a festival during the summer and they had checked, I am so sorry about this. They had checked our bags and everything. And I was at the right in front of the barricade, and all of a sudden everyone started running. And it was like hundreds of people, so many people left injured and everything. And I ran for like 4 miles with my friend. And my mom was watching it live on TV, and they were pretending like nothing happened. That's like the worst part, because she's like, well, they're still like there's still performers, and they were showing like clips from the audience earlier, which was just like, why are we pretending like this didn't happen when, you know, that it was terrible. And then even at a mall, I ran out of a mall. There was helicopters and everything. And like, luckily one of my mom's friends works at the mall, so we met up with her. But this was all in the span of like a year or two. Luckily, nothing has happened recently, but you know, it's hard knowing it happened anywhere, anytime.
Sadly, this is what life in America is like. Every time I go into a grocery store with my kids, I literally think, where are the exits and where am I going to hide them? God forbid something were to happen. I think that when I go to a movie theater, I think it when I go into a store. It's just part of everyday life in this country. On this super and upsetting note, I'm gonna thank all of you for being here. Everybody who joined this call today, everybody who's watching. Thank you, because these are the people that we are going to elect to solve this. These are the people who think about these issues every day, because you legislate based on your lived experience. You legislate on what your kids are going through at school. You legislate on what it's like being a parent in this country. And we need those voices at the table. We have more millionaires in Congress right now than we have moms. That needs to change. So I am thrilled to be able to do this work every day to support moms running for office and to try to make it easier for you guys to run and to share your experiences. I am honored to partner with Healthcare Awareness Month and Rachel and Peter, who are just the most badass advocates that exist. And Annie Andrews, one of my favorite congressional candidates this cycle. You're absolutely incredible, and I'm so thrilled to see everything that you are doing. You're running such an incredible campaign. And Rep Salman and Kaegan, you guys are running amazing campaigns. I'm so honored to endorse you. I'm so honored to work with you. Thank you. You give me hope for what will actually happen when we get more moms into office. So thank you for joining us today and for taking the time out of your very busy schedules as we're getting close to Election Day to come and to speak with us. Thank you so much. Do you guys want to say any closing words? I know we are at time, but I'd love to give you the opportunity to just say a few things, just closing if you would like.
Just thank you so much. And thank you to Vote Mama for being the catalyst to help encourage women like us to run for office. And thank you to the young voices that joined today, and gives me more motivation to keep fighting.
Yes, thank you. Thank you so very much. This is a badly needed space to support young parents, young mothers running for office. We're in such a unique club, so to speak. And I'm so grateful that Vote Mama exists just to provide that support. And thank you so much for allowing us to participate. I feel very honored because, there's a sitting lawmaker and an actual medical professional in me. And so I feel very grateful to be a part of this conversation. Thank you.
Yeah, thank you for organizing this panel, for including me, and it was a pleasure to meet everyone in this space, including the fellow panelists. I wish you so much good luck on your campaigns. I'm so excited to see your careers and your future, and to be amplifying all the work that you all are doing. And again, thank you for being the forum to bring us all together. Vote Mama. It's a needed space that often gets overlooked in the political atmospheres. And so to have this and to be included in that really means the world to me. So thank you, everyone. And thank you so much for organizing this today.
Thank you. Thank you very much. And we will, I know that I think Sarah or Louisa is sharing some more details about your campaigns in here, right? And the links, if anybody wants to learn more about your campaigns, we'll make sure that everybody who has joined has that information. So thank you so much, and go kick butt and get elected. I'll talk to you soon.
Bye.
Have a great day, everyone.